So first of all, for people that are maybe rather new to rabbit dentistry, we always want to talk about how many teeth bunnies have. I find in my exam room, I always try to especially have little kids come and look in the rabbit's mouth with me. Sometimes owners too, because again, short of the incisors, they forget that there's actually 28 teeth in there. Believe it or not, they have actually 6 incisors. So they have the top and bottom that you see, and then little peg teeth that I'll show you here in a second that are pretty insignificant, but do exist. They sit right behind the upper incisors and are very, very short. No canine teeth. They have a little space, and then we have 12 premolars and 10 molars. Those are collectively called the cheek teeth. So if you're talking to your veterinarian, they refer to the cheek teeth, they're actually talking about all of those. So here's just a little skull, just showing, what we see when, from a cross section, and showing the cheek teeth back here. You can see the incisors, and behind them you can see these little peg teeth. I forgot my pointer. So once a lagomorph, always a lagomorph. So rabbits' teeth are continuously growing throughout their lifespan, which most of you probably already know. It's well documented that dentistry and dental issues, unfortunately, are very common in bunnies. But rabbits' teeth grow approximately 1 to 5 millimeters per week, and obviously that's makes them unique. I will say as they get older, that growth rate does slow down a little bit. But for bunnies that unfortunately have either malocclusions, where they don't have a normal bite, or they suffer from other forms of dental disease, that growth pattern can be significant. That's why we see these guys so often. Oops. Okay, this slide is a little cartoonish, but I still think it's pretty helpful, kind of talking about what's normal and not normal. So on the left-hand side, on the top, you see your healthy incisors. And what's most important to know about your incisors is those top incisors come down, and those lower incisors should come back and fit right behind the upper ones. In fact, they rest on those peg teeth. I guess I shouldn't say they're totally insignificant. When we talk about malocclusions or an underbite or overbite, you're usually going to see those lower teeth protrude in front of those top incisors, and that's when they start to grow all cattywampus and can be pretty significantly scary. The cheek teeth, and this is a little cartoonish, because normally when you look in a rabbit's mouth, you normally see sharp edges. It's not rounded like is portrayed in this picture. But what this picture does a decent job of showing is when you look in their mouth, the inside aspect of these lower teeth and the outer aspect of these upper teeth are normally going to be more sharp than is shown in this picture. As they start to overgrow, you'll see how these start to splay out, and that's where you get spurs or sometimes some really significant hooks that start to irritate the soft tissues in the rabbit's mouth. Unfortunately, there's a lot of causes. Sometimes we never really know for sure. We'll go through specific examples of this in just a second, but genetics are probably one of the biggest things. Trauma certainly can be a common cause. Diet, in my opinion, is probably one of the most common causes. And one area that is developing is there a relationship with other systemic diseases, metabolic problems, so internal, maybe vitamin deficiencies or organ dysfunction that then can result in teeth that are either softer than normal, weaker than normal. And again, we'll touch on that here in just a second. So again, what is a malocclusion? Talking about genetics, those are the bunnies that come in at 4 to 6 months of age that the owner's concerned because they can actually see that their rabbit's bite is not normal, and we'll see all kinds of walrus-looking tusks coming out, and those are pretty easy to identify. These are going to be the ones that probably have a genetic relationship. Here's just a skull. Unfortunately, bunnies doing crazy gymnastic-y types of things, jumping, falling, chewing on wire, what have you. Just bad luck. Here's a bunny that actually had quite a couple different fractures. I'm not sure which came first, the chicken or the egg. If it broke its top incisor here, and then this one maybe grew longer and then fractured off because, again, it didn't have that buddy system to protect it, or maybe it actually fractured both. I'm not sure. You can actually see those cute peg teeth nicely in that picture. They are cute. So diet, again, most common cause of dental disease is improper diet. We all know the importance of fiber in our rabbits' diets for multiple reasons, from GI health to they need that high roughage, high fiber containing diet to help keep things in check. Bunnies don't chew their food like we do. They have a very scissor-like action made to cut through all that fibrous hay and all those nice chew toys to help keep things in check. And so this picture just kind of sums it up for me, because it's, you know, you go into a pet store and unfortunately you got this big crock of pellets and no hay. They're kind of setting those bunnies up already to be somewhat unsuccessful in terms of their teeth. And I'll be honest, I've had clients come in with a 8-year-old rabbit that's never been on hay, and sometimes we look in there and we expect to see badness, and like, wow, their teeth actually look pretty good. The bunny probably got lucky. So, you know, I'm not going to say every single rabbit that, you know, if you're thinking of adopting a rabbit and it's been on a less than ideal diet for a number of years, it doesn't necessarily mean they're all going to have dental disease. But unfortunately, it is a big culprit. Probably a combination of genetics and diet plays a role. If there's a potential for vitamin D deficiency relating to hypocalcemia or a lower blood calcium, and therefore the relationship on things like teeth. The research actually came back inconclusive, but it is an ongoing area that I think is of value. I think there can be a relationship with bunnies that develop, for example, kidney disease chronically. We know bunnies are living a lot longer than they used to, so you get your senior bunny, 8, 10, 12 years old, that might develop some kidney dysfunction. Well, there's a lot of important things made in our kidneys that help with our calcium metabolism. When that gets altered, could it actually affect their teeth? I think it could, you know, it has legs. We just don't know for sure. So I guess the take-home point on that one is if you have an older rabbit that has acquired dental disease, it's definitely worth looking at blood work just to make sure that there's nothing else going on, because we might actually be able to relate the two, even if it's kind of subjectively. So symptoms of dental disease. So eating poorly, not eating, usually it's going to be fairly obvious. Weight loss that is unexplained. You know, some of these guys are just maybe not eating one thing, and it's weird. A lot of my patients will either just not eat their pellets, or they might actually not eat their greens. And for owners that are really dialed into their particular rabbit, they know that's when they need to come back in and we need to recheck those teeth. There's not always a textbook guideline that says, you know, just not eating pellets. Some rabbits are much more tolerant. I've had bunnies come in and they're literally ulcerating their cheeks. They have such bad spurs in their mouth and they're still eating and pooping fine. I've had 3 rabbits just this week that came in that the owners, again, know their rabbits so well that they just aren't eating as great as they were, and sure enough, we do a dental and they're all better. So, and they really don't look that bad. Obviously, tooth elongation, anything that you do notice is reason to be concerned. We talk about slobbers or excess salivation, wet chin, matted fur or poor coat because they're not grooming because their mouth hurts is quite common, especially as they get older. Certainly that can be caused by other things, but dental disease is definitely something you always want to check for. Any kind of nasal, eye, or discharge around the face. There can be a relationship with their tear ducts. If the teeth are overgrown, they can actually occlude or block their tear ducts, so their tears run down their face and can cause sores. In extreme cases, if we get abscesses in there, especially behind the eye, it can cause the eye to bulge. Any kind of facial swelling, lumps, bumps, obviously around the face, we always want to be concerned could be related to a dental problem. Sometimes we just change their diet, give it tincture of time. So if I see that bunny that I'm like, you know, these points weren't here 6 months ago, let's add a second type of hay and recheck you in 3 months. Or add extra chew toys, or go to Bunfest and buy extra fun things for them to chew on. It's okay. If it's a clinically normal animal, giving it a little bit of time is perfectly fine. We don't want to jump into procedures involving anesthesia if we don't have to. Obviously, grinding or cutting of overgrown teeth, extracting teeth as necessary, incisors, molars, and surgery for abscesses. So just my soapbox that it is not acceptable, we probably all know this, to clip teeth with nail trimmers or side cutting tools found in a toolbox. Many times this does happen. I'm not passing judgment, but the likelihood that we are going to damage the root structures or fracture those teeth is going to be a lot higher. And if you find a rabbit savvy vet that is doing it properly, to trim just incisors, because oftentimes that does have to be done frequently for our malocclusion bunnies if we don't extract the incisors, that can be done pretty inexpensive.